Hello, my name is Dr. Kadir, and I'm a dentist in Oregon working with modern dental media to bring you this AI-generated video about cavities. In this video, I'm going to talk about what a cavity is, what causes them, and how to prevent them. Cavities are a way to describe tooth decay that occurs on the different surfaces of your teeth. Dentists call cavities Caries lesions since we think of tooth decay as a disease process that we manage as part of a patient's treatment plan. A cavity forms over a period of time when the tooth is exposed to acid created from the bacteria in the mouth. This causes demineralization, a process that weakens the tooth structure until it fractures. Before we talk more about cavities, let's briefly talk about your teeth. Your teeth are composed of an exterior, hard enamel shell that covers a softer layer of dentin. This dentin surrounds a pulp chamber where all of the blood vessels and nerves are located for each tooth. If we look at your enamel under a microscope, we see millions of tiny rods bundled together. These enamel rods form the outer shell that protects our teeth. Dental plaque is a white layer of bacteria, known as biofilm, that's constantly growing on your teeth. Brushing and flossing are the only ways to clear it. If left alone, these bacteria consume the sugars in your diet and produce acid as a byproduct. It's this acid that breaks down your tooth and creates a cavity. The acid released by these bacteria starts dissolving the minerals holding your teeth together. Dentists call this the caries process. Your mouth's acid level, or pH, is constantly shifting. Throughout the day, your teeth cycle between two phases, demineralizing and remineralizing. Every time you eat a snack, your mouth becomes more acidic. Once your pH drops to 5.5 or below, the danger zone begins. At this level, bacteria become highly reactive and the rate of cavity formation accelerates. This is because the increased concentration of protons pull out important ions from the tooth. One of the first signs of a cavity forming is a white spot lesion. It looks like a chalky, pale spot because the tooth has become porous underneath. At this stage, you can actually reverse the initial damage. You can remineralize a tooth or arrest the decay simply by brushing and flossing twice a day. Adding a fluoride mouthwash and toothpaste will also help. This process clears away harmful bacteria and treats your enamel with fluoride. Fluoride will rebuild the tooth's surface and make it more resistant to future acid erosion. If we don't change the chemistry here, the enamel continues to erode until the tooth eventually fractures. Once a cavity breaks the actual structure of your tooth, you'll need a dentist to step in. At this point, restorative treatment is needed to save the tooth. However, if too much of the tooth has been lost, you may need to remove and replace the tooth entirely. Inside a cavity, thousands of bacteria are constantly eating through the enamel. Once the decay hits the dentin, it moves much faster. This is because dentin is softer and less mineralized than enamel. At this stage, you'll likely feel sensitivity to cold drinks and sweet foods. As the bacteria gets closer to the pulp, the area becomes inflamed. This condition is called pulpitis. This can cause a toothache. The pain might be constant or it might come and go. Sometimes the pain will fade away entirely, but don't be fooled. That usually means the nerve has been severely damaged. To find the best way to save the tooth, a professional dental exam and x-rays are now essential. Past a certain point, a cavity won't heal on its own. The decay must be cleared away and the tooth restored so you can chew comfortably again. For small to medium-sized cavities, a simple dental filling is usually enough. But if the cavity is larger, you may need a crown to reinforce a tooth and keep it from breaking. If the decay travels even deeper, reaching the internal pulp chamber, a root canal becomes necessary. A root canal clears out the decay and the damaged pulp from inside the tooth. That empty space is then filled with a specialized medicated material called Gutta Percha. When successful, this procedure stops the infection from spreading to the rest of your mouth. About 2 weeks later, your dentist will reevaluate the tooth. If the area hasn't fully healed, you may need a retreatment to try again, or you might choose to have the tooth removed and replaced. However, if the healing is on track, the next step is usually a crown. This seals off the root canal and prevents future tooth fracture. Keep in mind, if a root canal isn't an option, removing the tooth entirely is the most effective way to stop the infection from spreading. When a tooth is removed, replacement options should be discussed with the dentist to prevent other teeth from shifting and to restore chewing function. In extreme cases, cavities can lead to infection and swelling in the mouth that can spread to other areas of the face and neck. This is a dental emergency and needs to be addressed immediately. Either a limited exam with a general dentist or a visit to the emergency room is needed for adequate evaluation and treatment. So, how do we prevent cavities? First, we have to remove the plaque biofilm every time it regenerates on the surfaces of your teeth. Brushing and flossing twice a day physically clears away plaque bacteria so they can't produce the acid that starts tooth decay. Second, we want to use a fluoride mouthwash. Your saliva is a liquid repair kit filled with calcium and phosphate. When you use a fluoride mouthwash or toothpaste, it acts like superglue for the minerals that keep your teeth healthy and strong. Fluoride helps rebuild the teeth and makes them resistant to acid erosion the next time the teeth are exposed. You can also protect your teeth by cutting back on sugary foods and drinks. If you do indulge in a sweet treat, try to drink water immediately afterwards. This helps wash the sugar off the surface of your teeth before it can do any damage. Drinking water does more than just clean. It also balances your mouth's chemistry. It helps move your pH back to a neutral 7, lifting it out of the dangerous 5.5 acid zone where enamel begins to dissolve. If we can slow or stop the caries process through good oral hygiene and annual visits to the dentist, you can keep your teeth and dental restorations longer and enjoy the foods you like without discomfort. Because once we remove a tooth, it can cause a domino effect for losing more teeth. So preventing cavities and addressing them early can improve the quality of your life. So think of it as a win-win for your health. You can protect your smile by following 3 simple steps. First, brush and floss twice every day. Second, cut back on sugary foods and drinks. And third, drink more water throughout the day. These small habits make a massive difference in keeping your teeth strong and cavity-free. By practicing these daily habits and seeing your dentist regularly, you can catch issues early. This allows you to choose less invasive and much more affordable options to keep your smile healthy. If you found this helpful and want more evidence-based tips for your oral health, make sure you hit the subscribe button. Thanks for watching and take care of those teeth. This video is for educational purposes only and does not constitute medical advice. Always seek the advice of a dentist or a qualified health provider with any questions you may have regarding a dental or medical condition.